thank you for your interest in learning more about the RWJF Culture of Health Prize. We are coming to you from Madison, from the University of Wisconsin Population Health Institute. My name is Carrie Carroll, and also presenting with me today will be Katie Weir with the Robert Wood Johnson Foundation. We'll be hearing from Katie in just a few minutes. We'd like to start by acknowledging that the RWJF Culture of Health Prize is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Many of you may know the UW Population Health Institute from our decade-long leadership on the county health rankings and roadmaps. We are partnering together and with others to help build a culture of health across the country. We want to take a moment before we get started to orient you to the Zoom technology we are using for this webinar. You should be able to see the slides we're showing in your viewer window. And when you scroll over the viewer window, you will see the webinar controls. At any point during the presentation, you can submit questions to us via the Q&A function. And when you click on this control, the Q&A box will open up, and you can simply type in your question and then click send to submit. And we'll do our best to answer your questions during the presentation and during the Q&A period at the end of the webinar. And if we don't get to your question during this hour, we can follow up with you afterwards. If you're having any challenges with the technology, please let us know via the chat function. And through the chat function, we'll also be sharing some very key documents. In fact, right now we're chatting a link to the slides for today's presentation. We're also sharing links on 2 other essential documents that are resources for the application process. The 2019 Call for Applications and the Frequently Asked Questions document. This document's extremely helpful for applicants. It answers actual questions we've received from communities in past competitions. So again, we're chatting out the links to those documents, and we encourage you to review both documents carefully as you prepare your application. So let's move toward the content of today's session. We'll start off with an overview of RWJF's vision to build a culture of health. Next, we'll cover the purpose of the prize program and competition, and including the growing list of communities who have won the prize in past years. We'll also actually spend the bulk of our time together talking about the application and selection process. And we'll have time for Q&A at the end, as I said earlier. So now I'll turn it over to Katie Weir with RWJF to tell us more about the Foundation's vision. Katie?
Thanks, Carrie. It's great to be with you all today. Our vision at the Robert Wood Johnson Foundation is one where we, as a nation, all strive together to build a culture of health, a culture that enables all in our diverse society to lead healthier lives now and for generations to come. The RWJF Culture of Health Prize honors communities that demonstrate outstanding examples of our vision in action, communities that have come together around a commitment to health, opportunity, equity, collaboration, and inclusion, especially with those who are historically marginalized and those facing the greatest barriers to good health. For us, building a culture of health recognizes that where we live, including our access to affordable, stable homes, quality schools, and reliable transportation, makes a difference in our opportunities to thrive. These opportunities profoundly affect our health and well-being. In our communities and our nation, we are at a point of great change which is cultivated by everyday people, by community members who are working together to transform neighborhoods, schools, businesses, and so much more, so that better health flourishes everywhere for everyone. We know that there are communities that are already creating a culture of health, and that's why we created the RWJF Culture of Health Prize. The purpose of the prize is to find those strong examples of communities that are creating a culture of health, one in which all people have a fair and just opportunity to live their healthiest lives possible. For us, the prize is a way where we can celebrate and elevate their successes, to affirm their direction, to inspire other local communities, and to provide ideas about what's possible. And to be clear, there is no one way to build a culture of health. Communities are going to approach it differently. The prize recognizes communities that are working together in new ways to ensure that all their residents have the opportunity to be healthier. These places and their journeys look different, but they all show us what a culture of health can look like. And it's important to emphasize here that the prize is not a grant. It is an award to recognize communities for what they have already accomplished on their journey to build a culture of health. Therefore, communities can use the $25,000 cash prize in any way they choose to enhance their work, and budget reports to the foundation are not required. The value of the prize goes far beyond the dollar amount, however. It is a designation, an honor, and an opportunity to recognize and elevate the work being accomplished in communities across the nation. Prize winners have their stories and successes celebrated as a way to inspire others toward locally driven change. Prize winners connect with other national and community leaders as ambassadors for building a culture of health. And prize winners are provided with professionally produced communication materials, including videos, photos, and stories, and are provided with strategic communications and outreach supports to announce their winning, celebrate their accomplishments, and serve as spokespersons at different events. And prize winners become part of a national prize alumni network to engage and learn with other prize winners and to network locally, regionally, and nationally. We've also heard from past prize applicants that the process of applying can be a great learning experience for their community. Applicants often report that they benefit from the process by bringing partners together, reflecting on what the community has accomplished, and using the prize criteria to identify strengths and opportunities. As one applicant shared with us, the introspection involved in writing the application served as a significant motivator for us. When we saw on paper how much we actually accomplished, it invigorated us to forge ahead and forge forward. We now have 39 communities designated as RWJF Culture of Health Prize winners. Congratulations to the 4 2018 winning communities, which were announced on September 18th. The 2018 winners are represented by the orange markers on this map here, and the past winners are shown in blue. We often receive questions about whether there's a population size minimum or maximum to apply for the prize, and whether the prize applies to rural as well as urban places. You can see from our prize winners, which span 24 states and include 5 native nations, that they represent all types of places: cities, counties, tribes, small rural towns, and interconnected regions. There are winners across a full range of population sizes, rural and urban, and everything in between, with all different physical, economic, and demographic characteristics and challenges. So with all of that said about the context of the prize, I will turn it over to Carrie to go into the actual application process.
Thank you very much, Katie. I'm sure this has whet your appetite for learning more about what you can do to bring your community to the forefront as a potential RWJF Culture of Health Prize winner. This slide features quotes from some of our past winners or alumni on what the prize has meant to their communities. And you can read so much more about past prize-winning communities. You can view videos and start the application process all at the prize website, rwjf.org/prize. The 2019 call for applications and the list of frequently asked questions are also on the same website, the rwjf.org/prize. And in a few minutes, we'll share just a few screenshots on precisely where to find these documents. But again, just really want to say that prize winners have said that winning the prize is a game changer, an opportunity to learn, a chance to tell your story, a great honor, and a tremendous journey. So the prize application process, it happens over the course of three phases. The first phase is the phase we're in right now. The phase 1 application is open to all U.S. communities, and we'll describe the application process in greater detail on today's webinar. One question we often get from potential applicants is they want to get a sense for how many applications do we receive for phase 1. And I can share with you that in recent years we've received around 200 submissions for phase 1 per year. So then after phase 1 we move on to phase 2, and a select number of communities are asked to proceed to phase 2. From the phase 2 applications that are submitted, we will then select a set of finalists who will receive site visits. And then following the site visits, the set of finalist communities, or from the set of finalist communities, will be the RWJF Culture of Health Prize winners selected. And I can also share that up to 10 winners will be selected. I said up to 10. So in past years, we've had the number of prize winners has varied, actually. So we've had 4, we've had 8, so it's varied between 4 and 8 each year. And we want to flag this deadline. It is Thursday, November 1st, 2018 at 3 p.m. Eastern Time. So this is the deadline for the phase 1. Want to underscore the time zone of Eastern Time, 3 p.m. Eastern Time. So this is an absolute deadline, and we want to share that no exceptions are made, including none for internet connectivity issues or any confusion with the time zone. So a really, really important date and time to mark on your calendar. On this slide, you'll see the overall timeline for the competition, and this is also detailed in the call for applications. But 2 other key dates I want to call out right now are that you have our word that you will hear from the prize team on December 7th as to whether or not an application is submitted to phase 2 of the competition, or a community application is submitted to, or advancing to phase 2. And then just a heads up for those of you that may choose to apply and may advance to phase 2, those applications are due January 17th. So it's a pretty fast pace. One of the most key questions we get asked very often is, who is eligible to apply for the prize? This prize is quite different from many others in that it's based on a geographic jurisdiction. So it is not a prize for a particular organization or a particular accomplishment. It is a prize that reflects the work across the whole geography of a place. And to be eligible for the prize, applicants must present an application that reflects the work of one of these categories, and I'm going to step through them because, again, they're very important. So a city, town, village, borough, or other municipality with a publicly elected governing body, a county or parish, a federally recognized tribe or state designated Indian reservation, a Native Hawaiian organization serving and representing the interests of Native Hawaiians in Hawaii. This is a customized definition for Hawaii only. Or a region which is defined as geographically contiguous municipalities, counties, and or reservations. Communities within U.S. territories are welcome to apply, and there are many places throughout the United States where there are unique municipal governance structures, and we strongly encourage you to contact the prize team well in advance if you have any questions regarding eligibility. Please don't hesitate to contact us well in advance of the deadline so we can discuss your community's governance structure in more detail. And then I want to add that for the purposes of the prize competition, neighborhoods are not eligible to apply. And we understand that in larger cities, it's a challenge to represent the work and the accomplishments of a whole city. But this is the charge, and we ask that you please strive to do just that. And we cannot look at neighborhoods alone. So it is perfectly acceptable within the context of the city or the county-wide application to feature the good work of a neighborhood, but please do so in the context of broader efforts that are taking place within that town, that city, or that county. So as we've said, the prize honors the work of whole U.S. communities. Submissions representing the work of a single organization will not be considered. An organization or coalition can certainly take the lead in preparing and submitting the application. That works well. We know that someone has to be that author of the work, that leader, that convener, that really says, this sounds like our community. But please keep in mind the whole community. And if the application focuses only on the work of a single organization or a single program, it will not move forward. We receive a lot of questions about eligibility, as I said, and so I'll address a few of those now. One question we often get asked is probably pretty clear from the map that Katie shared earlier of past prize winners, but the question is this: can communities located in the same state as previous prize winners apply? And again, the answer is yes. We look at each application individually and not in relation to other applicants or winners located in similar nearby geographic areas. Another question we get is whether past applicants can apply again. And we know that building a culture of health is a continuous journey. And if you're a past applicant and feel that you've made significant progress on your journey, then we welcome your application. Past applicants are evaluated individually each year and not in relation to what they may have previously submitted. Exceptions to this are past prize-winning communities. If your community has already won the Culture of Health Prize, you cannot reapply again. Also, communities that were designated as finalists for the 2018 competition are asked to sit out at least one round before they reapply. And the list of past finalist communities can be found in the prize FAQs document that we've alluded to. And also, past prize winners are listed in the call for application. So let us know if you need more information on those. All right, now we will turn to the criteria by which all prize applications are judged. And the most important element in how we select those who go on to be an RWJF Culture of Health Prize winner is how the community performs across the 6 key criteria. So Katie and I are going to discuss each criterion one by one. This clearly is the most important part of this webinar. We've been asked how applications are scored and whether the criteria are weighted during the selection process. There is no formal weighting of the different criteria. We are looking for communities that address all 6 criteria across the board and in a holistic way. So that said, in the phase 1 application, judges focus most closely on the first 3 criteria. And the first 3 criteria we consider foundational to building a culture of health. The first of the criteria is defining health in the broadest possible terms. And building a culture of health means using diverse and comprehensive strategies to address the many things that contribute to health. opportunity, and equity in our communities. In order to successfully improve health and address inequities, a community must be working across multiple areas that influence health. One way of thinking about the many things that affect health is by looking at the factors in the county health rankings model of health. When we talk about health, we define it very broadly. We're thinking about a wide range of factors, such as those you see in the boxes on the blue boxes on the right of this picture of health. These are examples of the type of influences that ultimately drive how long and how well people live. We are looking to understand how you are taking action across several of these areas and in a way that responds to the key challenges in your community, how you're reducing disparities, and how you're building on the strengths of your community. In particular, it's been shown that reducing health inequities requires concerted efforts to address social and economic factors. And we know that social and economic factors have the greatest influence on overall health outcomes. So judges are looking for prominent examples of how your community is improving social and economic factors. Some examples, how you're increasing high school graduation rates or providing access to early childhood education, how you're improving job training or enhancing community safety, how you're promoting economic development. These are some examples. So we're looking for how your community is addressing health from this very broad point of view. And now I will turn it over to Katie to talk about criterion number 2.
Thanks, Carrie. Our second criterion is committing to sustainable systems change and policy-oriented long-term solutions. For us, this means making thoughtful, data-informed policy, programmatic, environmental, and systems changes that are designed to last. Changes that don't go away if a grant ends or a program ends. And particularly changes that are designed and implemented in a way that intentionally focuses on reducing inequities in the community. This means demonstrating how community leaders, organizations across sectors, and especially residents who are most impacted by the changes are all involved in collectively identifying priorities and taking coordinated action to implement sustainable solutions to the health and equity challenges they face. We know no health issue can be solved with a silver bullet. As stated aptly by one of our prize winners, you're not going to affect change that really does move the needle on the health of the community without policy change. We are looking for how communities are pulling together strategies that go beyond providing programs and services to thinking about making lasting, equitable changes to policies, systems, and environments. Sometimes this may be at the level of government through laws and ordinances, but also could be at the organizational level, for example, changing systems and practices within businesses, workplaces, and schools. We've been asked for examples of policy systems and environmental changes that communities have undertaken. There are many, but a few examples include investing in community development, job policies that promote economic security, trauma-informed care systems in schools or law enforcement, smoke-free or healthy food policies, and physical environment improvements such as transportation plans that link housing, jobs, and healthcare. Carrie, on to you for the third criterion.
All right, the third criterion is about creating conditions that give everyone a fair and just opportunity to reach their best possible health. And this means intentionally working to identify, reduce, and ultimately eliminate disparities in health, and doing so by partnering with those residents most affected by poor health outcomes. We're interested in how your community is cultivating a shared commitment to equity, how the community is valuing diverse perspectives and actively fostering a sense of security, belonging, and trust among residents. Applicants are encouraged to show how the community is addressing disparities by taking action to remove obstacles and increase opportunities for all residents to participate in becoming healthier. And in particular, judges will be looking at how efforts go beyond targeting programs and services to residents experiencing negative health outcomes to really how community members themselves are authentically engaged in creating change that improves conditions and increases opportunities for all residents to thrive. Applications that really stand out in this criterion are able to provide specific examples of how residents from excluded or marginalized groups and those most affected by poor health are involved as full participants in making decisions and in driving solutions. If you look at the stories of past prize-winning communities, you will see some terrific examples of how communities are acknowledging complicated histories, how they're drawing strength from their diverse culture, how they're mobilizing residents and youth to improve neighborhoods and address issues from education to community safety to employment and income. Katie, please talk about the fourth criterion.
Well, as you mentioned, Carrie, the first three criteria are the main focus of the phase 1 application for the prize. However, we are also looking for standout work in the next three criteria, and more information will be gathered about these criteria as applicants move on to phase 2 of the competition. So criterion 4 is harnessing the collective power of leaders, partners, and community members. Is about how individuals and organizations across sectors and disciplines are all working together to provide everyone in the community with the opportunity for better health. We encourage communities to demonstrate how they have built diverse and robust partnerships across business, government, residents, nonprofit organizations, faith-based institutions, and more, including with quote-unquote non-traditional health partners, such as the community developers or educators or law enforcement. How are you creating the structures and capacity for shared buy-in, decision-making, coordinated action, and accountability across partners? We are also interested in how your community is fostering leadership skills and capacity among residents and inspiring people to take action to support change for better health. Carrie, do you want to talk about the fifth?
Sure, real quickly, we'll talk about the fifth and sixth criterion. The fifth criterion is about securing and making the most of available resources. And this means we're thinking with a real enterprising spirit. We would like communities to demonstrate how you are critically examining existing and potential resources and fully leveraging existing assets. Not just financial resources, but also your residents, your partner organizations, your community's institutions, your natural resources. Really, how are you joining forces to produce the best value for health? And communities are encouraged to demonstrate how you are prioritizing upstream investments that target those social and economic factors that we talked about earlier, and how you're making equitable decisions about how to invest resources. And sustainability is a critical piece here. So we're interested in how your community is creatively securing and integrating funding and other resources in a way that ensures your work will sustain beyond the completion of any one grant period or funding period. And then Katie, the last criterion, please.
The last, but certainly not the least criterion, measuring and sharing progress and results. For us, this means beginning with a destination in mind and really making a community-wide commitment to measuring the quality and impact of coordinated efforts. This involves several elements, including establishing shared goals and definitions of success across sectors and partners, around identifying measurable indicators of progress, including tracking disparities in health, and continuously using data to improve processes, track outcomes, and change course when necessary. We want to see how communities are developing systems for collecting and sharing information in ways that go beyond measuring the outcomes of a single program and moving toward being able to determine impacts across your coordinated efforts. We also encourage communities to share how you are communicating and celebrating successes when goals are achieved. Now let me turn it back to you, Carrie, to go into specifics about how to apply.
All right. So a few nuts and bolts about how to apply. As we mentioned earlier, everything you need to apply for the prize is available at rwjf.org/prize. And from this homepage, you can click on the green Learn How to Apply button to get more information about the 2019 competition and to begin the process. Once you're on this page, you'll find the price criteria, the eligibility information, and links to key materials. You can click on the funding opportunity brochure to link to the full call for applications, and you can download that PDF and print it as well. And I also want to note that we have the call for applications available in Spanish. And as we mentioned earlier, we very much encourage you as an applicant to review the very comprehensive frequently asked questions document. And you can also download that from the site. When you are ready to start putting your application together, you can click on Apply Online button, and this will take you to the My RWJF portal. This is where you'll work on your application. And if you've ever applied to the Robert Wood Johnson Foundation before for another purpose, you can simply re-enter your email, address, and password. And there's a place too where you can click if you've forgotten your password, and they'll supply it to you. If this is the first time you're making an application to the foundation, you'll first need to register. And you do that by just clicking on the registration button, and it will click through the process. When you get into the myrwjf.org site portal, you will go through a number of different screens that will ask for different information. And we're going to walk through some of that right now so you know in advance what to expect. Note that once you've registered, you can download the instructions for the applicant communities document. This is in the resources section on the left side of your application homepage. And this provides detailed instructions for what I'm about to overview now. First, you'll be asked for the name of your community, some community demographics, and 2 key contacts for the application, preferably from 2 different organizations. These will be considered the lead applicants, the people that we communicate with regularly regarding the status of your application. And then the meat of your Phase 1 application is really in the 5-page essay. And this essay consists of 2 parts, 2 main parts. First, you'll describe your community, and then you will describe your community's work by highlighting 4 accomplishments. For the essay, in the first page, about the first page, we don't limit you, but we provide guidance to spend about 1 page introducing judges to your community. So what that means is to please tell us a little bit about your key physical, social, demographic, and economic characteristics of your community. Please include vital assets and key challenges. You'll want to include any important historical or cultural considerations, as well as who in your community is most affected by poor health and what root causes might be driving poor health conditions. And then describe how your community's health improvement journey began and what catalyzed collective action. We really want to understand your community's story, what is unique, what's compelling about your community, how you got started on your journey to better health. And we ask that you introduce yourselves and make your community come to life for us. So after you spend the first page or so introducing us to your community, then you'll want to, in the following 4 pages, showcase your 4 accomplishments. And these accomplishments are specific policies, programs, strategies that you've deployed in your community that best respond to identified needs and that show how you are making progress toward better health. So in describing your 4 accomplishments, we ask that you weave in information about how your accomplishments address the key challenges that your community faces. And describe it if there, and describe if there are certain ways that your accomplishments may impact or intend to impact certain geographic areas or populations in the community. We'd like to get a better sense in this section about what your crucial needs and health gaps are and how you're prioritizing actions to improve the overall health of the community and address disparities. Some important things to note about these 4 accomplishments. Accomplishments can be well established or relatively new policies, programs, or strategies. We encourage applicants to demonstrate a balanced approach to community improvement. And this may feature well-established accomplishments as well as newer efforts. Applicants often ask whether an accomplishment needs to be one specific strategy or whether it can be a group of strategies. So I'm here to tell you it can be either. Some accomplishments may focus on a particular policy or program, while others may describe a suite of activities your community is doing to address a pressing need. An example here is early childhood education or community safety as one accomplishment. Accomplishments clearly need to be action moving forward. However, and for the purposes of the application, accomplishments may not be planning or convening processes, or the development of a coalition or a particular project. An accomplishment may not be your community health assessment or your community health improvement plan on its own. We recognize the importance of this work and of creating coalitions and bringing people together to do this kind of planning, but they're really viewed as the predecessors of your accomplishments. So they're the foundation on which your accomplishments are built. So while we like to hear about these kinds of things in your introduction, but as an accomplishment, we really want to know what actually happened as a result of the coalition coming together or as a result of the community assessment plan being developed. After you've completed your essay, we have a short worksheet, and this is sort of an abstract of the information you've given us so far. So we'll ask that you provide each accomplishment name, a brief description, and then indicate which of the health factors the accomplishment addresses, and approximately what year the accomplishment began in your community. This is just a brief summary of what you've included in your essay. We often get asked how to best choose which four accomplishments to feature. You have so much great work going on across your community. And there's really no one answer to that. We know how challenging it can be to narrow all of your work down to 4 accomplishments. So we encourage you to think about those 6 criteria and think about which 4 accomplishments taken together will best demonstrate how your community is living out the 6 prize criteria. And in the first phase, as mentioned, judges will be particularly honing in on the first 3 criteria. And that's how we decide who moves on to phase 2 of the process. So at this stage, at the phase 1 stage, we'll be evaluating your essay for specific evidence across the first 3 criteria. So that may also help you think about which accomplishments to feature. You might also be interested to know that phase 1 applications are evaluated by a range of reviewers from the UW Population Health Institute and our partners, our colleagues at the Robert Wood Johnson Foundation. Just a quick note on what comes next. So a select number of phase 1 applicants will advance to phase 2 of the prize process. And in the past, the number of advancing applicants has ranged really from 30 to 50 applicants. So phase 2 gives the opportunity to further expand on the work of a community across all 6 prize criteria. There's a second written essay, a brief video featuring community members and voices, and then a draft site visit itinerary that lays out what you might show the judges if they were to visit your community. So then a select set of phase 2 applicants are publicly recognized as finalists in the prize competition. So the number of finalists has varied from 10 to no more than 16 per year. The site visit is an opportunity for communities to give life and voice to phase 1 and phase 2 applications. So please know that much more information would be shared with communities that advance through each phase of the competition. But just wanted to give you a heads up on what you could look ahead to if your community should move forward in the process. We get a lot of questions about what makes a successful application and what are some of the reasons applicants are not chosen. So what we decided to do, since there's really not one simple question to these answer to these questions, but instead there are several things we've seen across several years that contribute to a strong prize application. We thought we'd summarize them here. So this slide I think is really helpful and hopefully sort of summarizes what we've covered today as we've talked about eligibility and evaluation criteria. So real quickly, I might just step through these to underscore some of the things we've already talked about, but stronger applications tend to demonstrate a community-wide focus. That should sound familiar to you. We see applications that are stronger, that are responsive to community needs and disparities, or are able to demonstrate a responsiveness to community needs and disparities in a way that builds on community strengths. Strong applications tend to focus on addressing social and economic factors, as we've talked about. They provide evidence of policy, systems, and environmental changes. They provide evidence of specific actions taken to remove obstacles and increase opportunities for all to be healthy. And strong applicants tend to tell us about how their residents, especially from marginalized or excluded groups, are really engaged in making decisions and implementing solutions. Applications often do not move forward because they might do one of these things, one or more of these things, but focusing on the work of a single organization, program, or neighborhood is problematic. We won't advance an application that features fewer than 4 accomplishments, or one that includes planning, convening processes as an accomplishment, as we just talked about. Those that include a limited breadth of accomplishments do not advance. We want to see work across broad health factors, so not a good idea to only focus on a single health behavior or clinical care area, for example. We don't advance applications that also might emphasize programs and service delivery without saying more about the policy and systems change efforts of your community. Less strong applications lack information about who in the community is experiencing poor health and how disparities are being addressed. And less strong applications lack specific examples of how residents are experiencing inequitable health outcomes and are engaged in driving solutions. So hopefully none of that is new to you, and instead summarizes the material we've already walked through with you today. All right, we're nearing toward the end of our time together. We definitely have some time left for Q&A, so just don't forget to be chatting those in. But just a reminder that you can learn more about the community's Building a Culture of Health on prize.org/prize. Take a look at those videos. People often ask us for specific examples of communities, so that's a great place to go and learn. You'll see videos and stories of 39 prize winners to date. And we are not asking you to be a cookie cutter replication of what you see there, but we do suggest that as a way to get a sense for the range of work being done in communities and how winning communities are bringing together people and sectors to address unique challenges and needs, and how all the different types of communities that can become prize winners. And if you visit the website on October 10th, we'll be live streaming parts of the 2018 Prize Celebration event. There'll be conversations with this year's winners, and it's a great opportunity to learn more about inspiring journeys toward building a culture of health. There'll also be some Facebook Live discussions on that day, October 10th. Which is the annual Prize Celebration and Learning event, where we'll be at the foundation in Princeton, New Jersey. So this brings us to the conclusion of our formal program. As a reminder, we will have a recording of this webinar available to you, and the slides shared with all attendees and posted on myrwjf.org for future viewing. We encourage you to view this webinar with your partners and work together with your partners on your application. I also want to remind you about the November 1st deadline, 3 p.m. Eastern Time. And now we'll keep the screen up here so that you can follow these links, but really want to spend a few minutes taking a few questions and answers and provide some answers. And I just want to say, Olivia Little is on the line, and she's a terrific resource for you. She's got tons of experience with the prize program, and she's been fielding questions, and you'll hear her voice in just a minute. So Olivia, let's open it up to Q&A. Anything come in that
Yeah, hi. This is Olivia. Yeah, we got several interesting questions in the Q&A, and one that I have saved for the for the live part is a question that asks, do we favor communities that have formed a formal collaborative partnership to address health, or is it sufficient to highlight a number of linked but not formally allied efforts? I was going to throw that to our presenters if you
Good question. Well, I could start. This is Carrie, and certainly Olivia, Katie, if you would like to chime in. But we very much want to hear about how your leaders and partners are working together to provide everyone an opportunity for better health. So that spirit of partnership that's in criterion number 4 is pretty important. So we'd like to hear about how you're building a shared sense of accountability and developing methods for buy-in, decision-making, coordinated action. So I wonder if only having examples of work going on in the community that aren't aligned and linked, I'm wondering how strong that application would be, in that it would not demonstrate many of the concepts in the 6 prize criteria. But I invite others to chime in if you have a different answer or additional.
This is Katie, and what I might add is I think we recognize collaboration happens differently in different kinds of communities. And so it's not only about a coalition, for instance, that's going to make work happen. And to just build on what you said, Carrie, I think being mindful around how you are living out those principles in your work is the most important factor that judges are using when looking to identify applicants that move on to the next phase.
Yeah, thank you, Katie. Thank you for that question.
Great, yeah, thank you. Another one that's come in, a couple of related questions, so I think I'll wrap them together. What entity receives the prize, the cash prize, an organization or a municipality, and since the award is for the community, the entire community, how might a prize be spent? Do you want me to start on that one, or?
Yeah, that'd be great, Olivia.
Sure. So just to note that the community applying decides who receives that $25,000 cash prize and how it is spent. So applicants that move on to phase 2 of our process will be asked where the prize money should go should they be selected as a winner. And there are a few restrictions in terms of it needs to be a governmental entity or a 501c3 organization or a educational institution. But basically, your community gets to decide that, and also gets to decide how the funds are spent, as mentioned earlier in the webinar. We don't track how those funds are spent because it is an award for work that you've already done, and your community partners can decide how to spend that money to best benefit the community going forward, and the budget reports about that are not required to the Robert Wood Johnson Foundation. And let me know if I got all that, my other presenters.
That's right. The only thing I would add, Olivia, is that when we go through that process of doing due diligence on our end for making the awards, there are some circumstances in which we at the foundation have needed to change the designated recipient. But those are conversations that we have with the community, and so it is certainly a process of doing with, not to, as we move forward in making the award.
Great. Thank you. Several questions, so let me take a look. This is a question about being the lead organization on an application. Is there a minimum operating budget requirement? And we got a couple of questions earlier about whether nonprofit organizations are eligible. So just to clarify on that, as we've discussed a lot, an application is eligible if it reflects the work of a whole community. But we know that there is someone that needs to pull the application together and convene partners and do that, that work. And so the contacts on your application, there are 2 contacts that we ask for, can be from any organization. There's no requirements about what that organization needs to be, how big it needs to be, what kind of organization it needs to be. It can be whoever is pulling together that application and being that main contact.
Mm-hmm. Yeah, on page 5 of the call for applications, there are several types of organizations provided as examples, and one of them is a community coalition, a grassroots advocacy or resident group. So it does not have to be a formal structure to be an applicant contact.
All right. Great. A question, you mentioned that collaboration must be self-sustaining even after a project ends, asking to explain that concept more. I think that's a question about how we talked about sustainability beyond any one grant or project, if I'm getting that right. Carrie, do you want to speak to that?
Yeah, that's a great question. What is sustainability? I think that we want to hear if a particular accomplishment is featured that is, for example, grant funded, that we want to hear about how you're thinking about sustaining that work for the long haul. So one way that some communities have spoken to this in the past is to, even though maybe a grant went away, they were able to articulate how that work was sustained by partners, by others in the community. So again, I think we're just not wanting to hear about, you know, the work in the course of a 1 year or 2 year grant, as we know they can be pretty short in time frames often, but really how is that work important enough to your community that you have found ways to think about sustaining the work outside of the grant period. But Katie is an expert program officer and probably has a little bit more to say on that.
No pressure, Carrie. Well, what I was thinking in response to this question is that for us, as we read the proposals, as we do the site visits, what's helpful is to understand the community vision and the trajectory of the community. And so helping us understand the various efforts, sort of where they've come and where they're headed in that trajectory, and recognizing, to how Carrie talked about sustainability, is seeing it beyond sort of a project by project or initiative by initiative, but really understanding the broader stream in which it's situated and how to understand sustainability potentially through the lens of financing or funding, but it could also be through the lens of other kinds of policy change or other ways you're changing standards of practice. I think there are lots of ways of understanding sustainability as well as resources, and that for us, financial resources is one component, but recognizing there are lots of other assets, including the human capital within your community, that helps to power your vision.
Probably have time for one or two more.
Sure. How many more years does RWJF expect to have this award? Send that to Katie.
At the moment, we haven't put an end date on it. We recognize that our vision for what it takes to build a culture of health is around looking that those changes are going to take at least a generation to happen. And we recognize the importance of prize winners across the country and helping to elevate what's possible and to demonstrate to others in this nation how they might both feel inspired and instructed about what it might take to build a culture of health, recognizing that a culture of health looks different in different kinds of communities across the nation. So I can't give you an end date. We haven't talked about one.
All right. I wanted to thank you, Katie. I want to reiterate, as we're getting more and more questions, that if we don't get to all of your questions, we can reach out by email, or if you stay on the line, type a few more answers as we wrap up in our time. Why don't I throw out this one that just came in, because I think this is an important question that a lot of people ask as well. This is talking about how the 2018 county health rankings, and this is a specific question about getting information about high school graduation rates from that information. And you know, if your community has data that's not reflected in the county health rankings, for example, could you use that information in your application, even if it's not been published, or how would that influence your application? And I'm happy to start on that just by saying that that we don't your county health ranking, where you fall and where you fall on certain factors, does not influence your evaluation of a prize application. We evaluate very closely on the 6 criteria that were laid out. So so we're not basing any of our evaluative judgments on your rankings. And we welcome any local data that you have about your community, about your outcomes. Multiple data sources are great. So certainly that is welcome.
Great. Thanks, Olivia. I think we are at time. We want to thank everyone who's able to join us. As we wrap up, we're putting up a couple of questions, and we'd love to know how today's webinar has informed how you're thinking about applying for the prize. So Olivia has launched a poll. The first question we have is, this webinar informed my decision about whether or not to apply for the RWJF Culture of Health Prize. And then there's a second question around, does your community intend to apply for the 2019 Culture of Health Prize? And then we also wanted to, as those results are coming in, we also wanted to share a quote about sort of the value from a prize applicant. Again, this person shared with us that the importance of reflection, really, that we often forget to stop and smell the roses and reflect on our endeavors, and the prize experience has allowed us to do just that. So reflection is a big part of the RWJF Culture of Health Prize competition, and we hope that you find that to be true. So we'll be following up via email with this recording and a brief evaluation, and we really appreciate your feedback about today's session. And I could read the results of the webinar. Looks like the majority of folks found this webinar to be helpful to inform their decision about whether or not to apply. And yes, 46% of participants said this sounds like our community. So it sounds like they're interested in applying for the 2019 Culture of Health Prize. So we wish you the best of luck in all your endeavors, and we will stay in touch, and we hope you have a great day. Thank you very much for listening.